A very good afternoon, students. Am I audible? Just check. Am I audible? Okay. Good. Bharti, I can see you. Okay. So it's a half an hour session, students, and what we'll be doing, we'll be trying to, take important last minute, few important high yield questions on uh, which is very much expected that it will be asked. Okay, so let me reduce my volume so that I can, yeah, okay, let's start. So the last minute revision becomes very important, students. The last minute revision becomes very important, and we have already scheduled a course for the subject last minute quick revision from 9th onwards. So we are having course of 9th, 10th, and it will be a all those high probability questions followed by image based also and important last year questions, right? So let's start. Let's not. Yeah, good afternoon, Bharti, Prachi, Himani. Let's start, right? So let's start with the first image-based question and the important one. A study was done to assess the risk factor for breast cancers in 100 females from urban cities, for which image is shown below, right? How many actual risk factors may be ascertained correctly from the statistical analysis of the research, students? What do you think? So how many actual risk factors may be ascertained from the statistical analysis of the research? Is it 2? Is it 3? Is it 4? Is it 5? Just try. What do you think? Is it 2? Is it 3? Is it 4? Is it 5? Try. So this is a image given to you, and they are asking you about how many actual risk factors may be ascertained correctly from the statistical analysis. So I can see Kishore has went with 2. Okay, Sonam goes with C4. Okay, anyone else? Okay. Now, first of all, students, if this image comes, it's important to identify what is this. First of all, this is a representation. This is called forest plot. Let's make it very simple, right? This is forest plot. So basically, this is used in meta-analysis, right? And you know what is meta-analysis? Meta-analysis is basically there are many studies done on similar topics, and if you're trying to have a summary or average of all those studies, so we do the analysis called meta-analysis. So when you plot, so that is called forest plot. Now it has to be clearly understand what interpretation we want to draw from this image. So if you see, you have a x-axis, you have a y-axis, right? And if you see this y-axis line which is here, students, this y-axis line which we have, this line, please consider it as line of null effect, right? So this line is called line of null effect. This is your horizontal axis, x-axis, where we have measured, we are putting data as relative risk 1, 2, 3. Now all this, if you see milk consumption, you have a square here and you have a lines here, right? For menarche also you have a square here and you have a line here. And for protein consumption also, for increasing age also, and family history also you have. And you have a diamond shaped structure. So diamond shaped structure is basically the summary measure, right? Now each risk factor has been plotted. Now what we have, so this square represents, if it is big, it can be big, it can be small. You can see there are many places it is big, there are many places it is very small. So this indicates sample size, and the line indicates the confidence limit, lower limit and upper limit. If this crosses the line of null effect, or it touches the line of null effect, it is not significant. Just remember, statistically it is not significant. So you can see milk consumption crosses this line, not significant. Early age of menarche touches the line, not significant. Protein consumption crosses the line, not significant. When you come to increasing age, it is not touching this line of null effect. So definitely increasing age is one of the risk factors. Family history, it is also not touching the line of null effect. So this is also the risk factor. So you can see, based on what simple thing which I said, two things you can make it out. Increasing age and family history is the answer. So how many actual risk factors may be asserted? The answer is 2. Okay. Yeah. So it becomes very easy. What has to be remembered, students? As I said, you have a horizontal axis where you are plotting the relative statistics or absolute statistics, and you have a line of null effect. These two lines. Then these are individual studies. The square is it represents the size of sample, and this is the confidence limit. If this crosses the line of null effect, or it touches the line of null effect, it is not significant. If it doesn't crosses, it is significant. You come back to the question, you can see increasing age and family history does not touches the line of null effect. So these two are risk factors for this breast cancer. Okay, simple. The milk consumption touches the line effect, not significant. Early age of menarche touches the line effect, not significant. Protein consumption touches, not significant. Only thing which is significant is these two. Okay, so this is about forest plot, and this diamond shaped structure is the summary of overall studies. Okay, now let's move. Let's not. Yeah. Okay, the next question is, which of the following does not include specific protection under primary prevention? Just try this. Which of the following does not include specific protection under primary prevention? Right? Is it tab rifampicin to those in contact with meningitis, health education, pentavalent vaccination, wheat flour fortified with added iron? Try this. Which is not a part of specific protection? Yeah, Kishore Bharti goes with B. Very good. Anyone else? Specific protection. I am giving pentavalent vaccine. So if I am giving pentavalent vaccine, so I am trying to protect that child from diphtheria, pertussis, tetanus, Haemophilus influenzae, and hepatitis B. So I am specifically protecting. I'm taking rifampicin, giving to those contact with meningitis so that they don't develop meningitis. I am fortifying wheat flour with iron to ensure that the child or the person or the beneficiary is not deficient in iron. So if you see, A, C and D is specific, very clear about this. But when you're talking about health education, so health education is not a specific thing. It has not been mentioned. So it is not specific protection. So the odd answer here happens to be B. Very good, students. Let's move to the third question. Median incubation period means time taken for 50% of cases to occur, time between primary case and secondary case, time between onset of infection and period of maximum infectivity, or medians of several incubation period. Easy one, students. I hope everyone will be able to answer this. What does median incubation period means? Is it time taken for 50% cases to occur? Bharti goes with A. Sindhu goes with A. others also. Arvida Z also goes with A. Okay, good. So if you take COVID, nowadays if any example, if we are explaining anything, the best way of explaining is COVID. COVID incubation period, we must have, we know that it is roughly around 2 to 14 days. So 2 is the minimum incubation period and 14 is probably the maximum incubation period. Then what is this median? Median, as you know, median, measure of central tendency, time taken for 50% of cases to occur. So this is called median incubation period. Time between primary case and secondary case, you know what is this? Serial interval. Time between onset of infection and period of maximum infectivity, it is generation time. And when you're taking average of several incubation period, it becomes medians of several incubation period. So you know what is median incubation period. It is time taken for 50% of the cases to occur, right? Yes. And primary and secondary case, serial interval, onset of infection to period of maximum infectivity is generation time and this. So nowadays everything, it becomes easy to understand when we take COVID. Okay, let's take the next one. Very good, Bharti. Now, a 16-year-old girl walks into your clinic and asks for cervical cancer vaccine. Which of the following should be given? Bioware, Gardasil, TDAP or Rubavac. Try this. A 16-year-old girl walks into your clinic and asks for cervical cancer vaccine. Which of the following should be given? So, okay, Jalina goes with C, TDAP? No. Mahesh, Sindhu, B. Majority of you have answered B. Yes. A 16-year-old girl walks and asks for cervical cancer vaccine. So we'll go for Gardasil, students. Just for your information, this HPV vaccine, which is human papilloma virus vaccine, we have in the form of bivalent, which is also called Cervarix, which we have quadrivalent, which is called Gardasil, and 9-valent, which is Gardasil 9. So we have virus-like particles bivalent. So we have 2, 16 and 18. Here we have 4. Here we have 9. The dose is 0.5 ml, 0.5 ml, 0.5 ml, and it is intramuscular, and intramuscular, right? Now, this is a class for half an hour. This is a class for half an hour, Arvidizi, and we have a full sessions from Monday starting from 12:30 to 2:30, 2-hour session Monday, Tuesday, and on 15th. So it will be good for you all people to join, right? Okay. So in that we had a Biovac option. So Biovac is basically a chickenpox vaccine or varicella vaccine, which is given to prevent chickenpox. Gardasil I have already talked, and TDAP, you know, it is for diphtheria, pertussis, and tetanus, and Rubavac is for rubella. Now let's come to the next question. Study design of choice for finding out diurnal variation of fat in expressed breast milk for preterm babies. So you have to do a study. You have to design a study. So what is the choice of that study if you want to find the diurnal variation of fat in expressed breast milk? Will you go with prospective cohort? Will you go with ambidextrous cohort? Will you go with case control? Will you go with cross-sectional? Sindhu goes with D. Okay, cross-sectional. Yes. Bharti goes with D. Yes, students. You see you cannot go with prospective cohort. You cannot go with both retrospective and prospective cohort, which is ambidextrous cohort. And case control, definitely it doesn't suit. Which study is best chosen for such studies is cross-sectional. You go once, single examination study, try to find the variation. So this is the best study, right? And just to make ambidextrous clear, so it goes retrospective also and it goes prospective also. Now coming to cross-sectional, it is a single examination study. You go, you collect data, analyze it, compare it, and give your result. So that is your cross-sectional study. So that is best suited there. Let's take the next question. All the following are done to remove confounding except. All are done to remove confounding except. What is not done to remove the confounding? Try this. Sonam, Mahesh, Himani. So what is, all are done to remove confounding except. What is not done to confounding? Okay, D, C, D, Himesh, Himani. Okay, students, we have to understand. See, confounding, you know, what is confounding? Confounding is a factor which is associated with the risk factor also, and which is also associated with the outcome also, right? So, suppose I take here, coffee with sugar, and here I write MI, myocardial infarction, right? If I say excess consumption of coffee with sugar leads to myocardial infarction, so I'm making a mistake somewhere, because coffee with sugar is also associated with cigarette smoking, right? Cigarette smoking. Now, come, cigarette smoking is independently associated with coffee and sugar. Cigarette smoking is also associated with myocardial infarction, right? Now we want to ensure that, and so this is cigarette smoking. Here it is acting as confounder. So it is independently associated with this. It can independently leads to myocardial infarction. So how do we remove confounding? So confounding can be removed by randomization, very easily done. Known confounders, unknown confounders, it will be removed. Matching also, matching you do in case control study, students think. So you are trying to match the variables which is present in case to variables which should be present in control, so that case and control looks similar except that disease component. So you will be only matching, students think, those things which you know. The thing which you don't know, you will not be able to match, right? So matching is also done to remove confounder, which is removes known confounders. Now come to blinding. Now this blinding, the participants is blind. So participant doesn't know whether he is going to the study group or control group. The investigator is also blind. So if participant is blind, so it is single blind, so he doesn't know whether it goes into the study group or control group. I am the investigator, I am also blind, he is also blind. So this is the example of double blind. He also doesn't know in which group he falls. I also doesn't know what intervention I am giving to which group, so that I should not be biased. Or then there is a triple blinding where the analyzer, the statistician, he is also blind. Now, you know blinding, you know matching, you know randomization. So this indirectly will help us to remove confounding. But randomly I select you, I select you, I select you. This will not help us in removing confounding, students. So confusing. Blinding is definitely to reduce biasness. True, agreed. I agree with you. But if you see, if you have an option random selection, randomly you are selecting somebody, does that remove confounding? That doesn't remove confounding. So among the options given below, I'll go with B rather than going with D. Okay. Let's take the next one. In a prospective study, 1200 patients were randomly selected to study the effect of new drug. The drug will be given for 5 years and its association with cataract will be studied. What type of study is this? Is it case control? Is it cohort? Is it RCT? Is it cross-sectional? Try this. Imani, Jalina, Sonam, Kishore, Sindhu, Mahesh. So 1200 patients randomly selected to study the effect of new drug. The drug will be given for 5 years and its association with cataract will be studied. What type of study is this? Easy one. So you are using a new drug. Moment you are using a new drug, so it is an experimental study, or you can say interventional study. So case control study, student, is an observational study. Cohort study is an observational study. Cross-sectional study is an observational study. This randomized clinical trial is an experimental study. So the best answer here is C. Case control, cohort, cross-section. What do? You only observe. You observe, collect data, analyze and do. You don't do any intervention. Here you are going to use the new drug which will be used. So that will be clinical trial and you are randomizing it. So it becomes randomized clinical trial. Okay. Now let's move to the next one. A total of 130 patients were screened for disc prolapse by CT scan and confirmation of disease was made by discectomy operation. Out of 56 patients who screened positive in CT scan, 46 were confirmed for disease in operation. Rest 74 patients who were screened negative in CT scan, only 40 patients were confirmed negative for the disease in operation. Calculate the positive and negative likelihood ratio. Try this. What do you think? Long question, but read small in fragment, it will be easy. What is positive and negative likelihood ratio? Is it 2.875 or 0.53, 6.01? Okay, somebody answered. Nimula answered C. Jay answered C. Anyone else? Kishore also answered C. Okay, student, when such questions come, no, it is not important that we reach to with answer correctly. Answer will be definitely correctly if we know the process. So they are asking you positive and negative likelihood ratio. Now, if I go by the question, you see the screening test is CT scan, right? And the confirmation is done by discectomy operation. So first thing I know, out of 130 patients, the screening test I am using CT scan, and the confirmatory test is discectomy operation. This much is clear. Now, so if I write here CT and discectomy operation, out of 56 patients who screened positive in CT scan, 56 who screened positive in CT scan, 46 were confirmed for disease in operation. So CT scan said 56. Out of this, 46 were my true positive. Can I draw this information, students? 56 were total by the CT scan said positive. 46 was said by confirmed by DO. So my 46 is true positive. Let's come to the next part of the question. Rest 74 patients who were screened negative. So CT scan said negative. Only 40 were confirmed negative. So out of 74, what is 40? This is my true negative. Right? Now I have my true negative, true positive. This total value I have. Can we not make our true positive, true false positive, true negative, false positive? See how I do. CT scan 56 positive. Discectomy operation. This is the screening test, students. When this 56 went for discectomy operation, 46 were positive. Now when this 46 are positive, what is this 10 now? 10 is your false positive now. Clear? Now again CT scan said that 74 are negative. In 74, when I did DO, discectomy operation, 40 was confirmed negative. So this is my true negative. It means 74 minus 40, which is 34, is my false negative. So I have my true positive, false positive, true negative, false negative. Can we not calculate sensitivity? So sensitivity is what? 46 are true positive. So I have my 46 true positive, and what is my false negative? False negative is 34. So 46 divided by 46 plus 34. So I get 57.5, which is 0.75 value. What is specificity? What is true negative? I got 40 as true negative. So true negative I have already. What is the total people who are not suffering from disease? False positive and true negative. So that becomes 50. So I have my value specificity as 0.8. Now you know what is positive likelihood ratio. Sensitivity divided minus 1 minus specificity. You have your sensitivity value, you have your specificity value. You calculate this, you get 2.875. If you want to calculate negative likelihood ratio, that also we can calculate, we get 0.531. So what is the bottom line here? The bottom line is that can we know our true positive, false positive? Can we know our true negative, false negative? Once we know that, we can calculate our likelihood ratio, which is 2, positive and negative. Positive is sensitivity divided by 1 minus specificity. What is 1 minus specificity, students? 1 minus specificity is false positive only. Negative likelihood ratio is 1 minus sensitivity divided by specificity. What is 1 minus sensitivity? That is false negative. Simple. So it is very important to understand the question. So the screening test was CT scan, and that was subsequently verified by discectomy operation. So 56 was positive, 46 was confirmed positive. What is 10 then? 10 is false positive. 74 were negative. Out of that, 40 was confirmed negative. So what is rest? 34, that is false negative. So you have your all 4 values. Start calculating sensitivity, specificity. Once you know your sensitivity, specificity, you can automatically calculate your positive likelihood ratio and negatively likelihood ratio. Okay. Slight calculation is required, but the process is same. You have it. Process is not tough. Okay. Okay. Let's move. Which of the following option is true about receiver operator curve? ROC curve. Which of the following is true about receiver operator curve? It is a method of evaluating the quality and performance of test. It is plotted as test sensitivity as x coordinate versus its 1 minus specificity as the y coordinate. A perfect test has an idea under ROC curve of greater than 1. A decrease in sensitivity result in decrease in specificity. What is this, students? Anyone? Anyone who wants to try this? What is ROC curve? What is true about this ROC curve? It is a method of evaluating the quality and performance of test. It is plotted as test sensitivity as x coordinate versus its 1 minus specificity. A perfect test has an idea under ROC curve greater than 1. Just try. Okay, Sindhu goes with, Bharti goes with A. Very good. Doctor go with B. Arvidizi go with C. Okay. Pooja goes with B. Faiz goes with B. Okay. Now, see student, the answer is A. Answer is A, but let's try to understand what is receiver operator curve. Very easy. You see this. I have taken x-axis as false positive rate, right? I have taken y-axis as true positive rate, right? So you are comparing true positive and you are plotting a graph, curve, true positive and false positive. So what do you want, students? Sensitivity? False positive, can I say 1 minus specificity? Same thing, no? 1 minus specificity, if you do, that gives you false positive, and sensitivity is true positive rate. So what do you want? You want that your false positive should be less and definitely your true positive should be more. So you have three colors graph here, curves. Which graph you want? This is the best one, excellent one, because your false positive rate is less and your true positive rate is very high. So this is normally what we envisage, what we want. We can have this, then this is the worthless, so this is the way. So area under curve, receiver operator curve. So for a good test, what do you want? The sensitivity should be high. 1 minus specificity, which is false positive, should be lowest as possible, which is in the x-axis, right? And this is measured by an index called Yoden index. The value ranges between 0 to 1. 0 is not useful, 1 is highly useful. Now if you see, so this is receiver operator curve. Now come to the question. It is plotted as test sensitivity as an x coordinate, student. Now if you remember the graph, x-axis has false positive rate, means 1 minus specificity. So this option is not correct. A perfect test has an idea under ROC curve greater than 1. No, the value ranges between 0 to 1. So this is also incorrect. A decrease in sensitivity result in decrease in specificity. This is incorrect. So it gives you, it is a method of evaluating the quality and the performance of test. So you want your false positive to be as low as possible. You want your true positive to be as high as possible. So that is what is envisaged. So this is called receiver operator curve. It ranges between 0 to 1. 0 is not useful. 1 is highly useful. Okay. Now let's take the next question, student. A patient with clustered white lesions on the buccal mucosa opposite the upper first and second molar, pathognomic for measles. These are what? Very easy question asked. A patient with clustered white lesions on the buccal mucosa. So yes, I think nobody should get wrong in this. If I can see, is it leukoplakia? Is it Koplik spot, capsoid spot? None. Yes. So we'll not, this is the easiest one. So the answer, measles, pathognomic feature is Koplik spot. Right. So let's move forward. This you know. Let's take one more question. Mass drug administration is not helpful for. Please think and answer, student. Mass drug administration is not helpful for lymphatic filariasis, vitamin A deficiency, worm infestation, scabies. Think and answer. Think. Mass drug administration. Okay. Now, MDA is very common for lymphatic filariasis, right? We give lymphatic filariasis. In lymphatic filariasis, we use MDA, mass drug administration. In worm manifestation also, national deworming we do. Students, vitamin A deficiency also, we also give 6 months, biennium, every 6 months to the children, every children till 5 years of age. Do we give in scabies also the same way? Have we ever thought that in scabies, do we do mass drug administration? No, we don't do mass drug administration. We only give to all that person, 5% permethrin to that person and the close contacts. So the answer should be D, not B, C, A definitely nobody will answer. Is not useful. This is the question, not useful. So it is not useful for scabies. Okay, let's take one more. This is also important. Transmission assessment survey is for Plasmodium vivax, Plasmodium falciparum, Leishmania donovani, Wucheria bancrofti. Yes, blanket treatment you do. Absolutely right. But suppose I am suffering from scabies, so my all contacts will be given, will be treated, blanket treatment. But we don't go for mass level, the entire community, we don't start giving the treatment. Yeah, so transmission assessment survey, Sindhu Vijay goes with D. Anyone here? Fatima goes with C. Lismenia, don't know any. No. Student tasks, please remember this as tasks, and very important thing. Transmission assessment survey is basically done in lymphatic filariasis. And lymphatic filariasis, you know, it is caused by Bucheria bancrofti, right? So it is done in lymphatic filariasis. Filariasis is caused by Bucheria bancrofti. I'll tell you what is TAS. Please remember this. Students, in lymphatic filariasis, what we do, we give mass drug administration, MDA. We are using now two drugs, DEC plus albendazole. Recently, a 3-drug regime is also it's also used nowadays, which is where we are adding ivermectin also. But majority of the places we use DEC and ALB for 5 years. Please remember, mass drug administration is done for 1 year, 2 years, for 5 years, and the coverage should be greater than 65%. It should not be less than 65%. Once you are done with this MDA, after 6 months of that, what we do transmission assessment survey, which is called TAS, to evaluate whether MDA was successful or not, and whether if it was successful, can we stop MDA there or not. So TAS is a very important evaluation tool for lymphatic filariasis, and the how mass drug administration program has performed. So this is basically about TAS. So I'll stop here, students. So we have from Monday onwards, 12:30 to 3:30. We have means a quick revision on the important questions which may be asked in AIMS. This, if you see the question, no, majority of the questions were recent questions asked either in AIMS, either in JIPMER. So it's very important to have a correct understanding of this topic, followed by the concept regarding this, so that it's important and it becomes easy for us to answer the questions. With that note, students, I stop here. I'll look forward to you joining on Monday 12:30 on Unacademy platform. So please, you can join it, and initially I have shown you how to get into that course. With that note, students, thank you very much. I hope the session was useful for you. Take care. Bye-bye.